interesting remedy. Just like always, my idea to explore some new remedies, some remedies which we already know, how we can understand it a little better. So let's try to study 2 or 3 interesting remedies for today's times. The remedy we study today is the remedy Podophyllum, one of the most well-known remedies for diarrhea, diarrhea in children. Belongs to Berberidae family. And let's try to first know what we already know about this remedy. So it's one of the most well-known remedies for diarrhea in homeopathy. What is the type of diarrhea? The diarrhea is often long-standing. Often they get it early in the morning. It goes on through the forenoon. And with a sensation of weakness and sinking, is very important. That's well known for Podophyllum. Watery stool, profuse, gushing out. Sometimes jelly-like, here it comes like hello, undigested. Sometimes yellow meal-like, and it can also have like a prolapse of the rectum. And that's why it's a very important remedy for prolapse as well. It's also a remedy for prolapse of uterus, interesting. It's generally very right-side remedy, and this is a very lesser known indication of this remedy. The other thing that I want to tell you, which is also very interesting, all symptoms are aggravated early morning, like aloe, like nuts. Hot weather is an aggravating factor. Dentition is an important factor, dentition diarrhea. And after ipecac and nux have failed or have helped in gastric affection, Podophyllum should be thought. And after calcarea and sulf have been given in liver disease. But I'm here to talk to you also a little bit about some more interesting phenomena about Podophyllum. And one of the main things about Podophyllum, which is worth evolving and understanding, is that they are one of the most loquacious remedies in homeopathy. Loquacity during fever. Loquacity changing quickly from one subject to another. Now here you can think about Loquacious, Hypochondriac, but look at Podophyllum. And also loquacity during chill and heat. So in fever, when especially children are very loquacious, you think about Cucrium marum, you think about Loquacious, you think about many remedies actually. A very important remedy is Podophyllum. So this loquacity is a very strong symptom of Podophyllum. Let's try to understand it a little bit more. The other very important thing about Berberis, and which is worth noting, is their fears. And very often it's a very important remedy in liver complaints. A lot of fears, fear of disease on getting up with a dull pulsating kind of headache in fever, Podophyllum. Fear that suddenly just they are passing flatus, array, I'll pass the stool also, Podophyllum. One of most forgetful remedy, word hunting. Hypochondriac in liver complaint. This is also a very interesting phenomenon. They after their diarrhea and all this kind of indication, they become very anxious. And they often later on may go into an IBS, irritable bowel-like syndrome, and that's where they become very hypochondriac. They think, oh, I have this problem. Oh, I could have that problem. Oh, I could have that problem. Hypochondriac. In much later stages, and I want to tell you, I learned about this from Dr. Sarkar actually. When you study Podophyllum and many of the, let's see if I can show you this. I've written about it in Just You See. So there's a little kind of research done, and this I learned mainly from Dr. Sarkar, that Epidermophilotoxins are substances which are occurring in root of American May plant, that is Podophyllum, which are derivatives in allopathy. They are used as anti-cancer drugs typically because They inhibit topoisomerase. So it's very important. In children's cases of leukemia, Hodgkin's disease, testicular tumor, alopecia, after after giving the chemo, alopecia, think about podophyllum, nausea, vomiting, testicular tumors, hepatic toxicity. So very important for hepatic. When the spread is to the liver with diarrhea, think about it. Childhood cancers. A very interesting indication that one of my favorite books, N.M. Chowdhury, is that there is always a loud gurgling in the abdomen before stools. This is a very important indication. Loud gurgling. While during the stool, there is great heat and pain in the anus. And the feeling as if genitals will come out. Like how the feeling in CPI is something coming out. They feel that something is pushed out from their uterine. Very interesting in podophyllum. Let's try to understand podophyllum from the pathological point of view a little bit more. Diarrhea can alternate with other problems like headache, generally morning till 5 a.m. Also midnight diarrhea, 3 a.m. But a very interesting thing is diarrhea night ameliorate. It has podophyllum. Always aggravated by sour food, podophyllum. Diarrhea better by warm application. So they put warm there, they feel better. Here you can compare Rustov, silica. A lot of vegetables causing aggravation, like diarrhea after cabbage, after boiled food. Can you imagine boiled food? After buttermilk. Boiled food is interesting because podophyllum somehow cannot tolerate heat too much. And that's one of the important aggravating factors, summer diarrhea. Children, so dentitional diarrhea. Least change in diet, like nux vomica, like neck from cow. As soon as they eat, after that they pass through. So immediately diarrhea after drinking, after eating, after canned fruit. So any juices that they are drinking. Diarrhea after fruit in hot weather. So you have a watermelon here in the summer heat of Mumbai, right? And you develop diarrhea, podophyllum. Always wants to lie on abdomen, like ammonium carb, like thyroidenum. Also pregnancy diarrhea with prolapse. Prolapse is a very important concomitant of this remedy. Hot weather aggravates, also very important. Painlessness. Painless summer diarrhea. So in the summer, painlessness is a very important for podophyllum. A lot of heaviness, draggy feeling. So that's a little bit about, you can say, podophyllum. I told you it's a very right-sided remedy, and that's why you can think about the liver first, and then ovaries, scapula, throat, all right-sided. Very important symptom, better by stroking the liver, like nat self. So it also means a little better by pressure. Always some liver-related problem, biliousness. In much later stages, in much later stages, which I what I want to tell you, podophyllum, and podophyllum also very important for moist, foul, prolapsed kind of piles. Is that in much later stages, you will see them moaning a lot, moaning in children, moaning during dentition, like this, and moaning during sleep with eyes half closed with rolling of head. This also shows a lot of brain-related problems. So in podophyllum, when after diarrhea, after all these kind of symptoms, patient loses consciousness. Certain fevers, patient goes into meningitis. Sometimes head tumors, moaning with eyes half open with rolling of head, a little bit like opium there, a little bit like tarantula. Moaning with grinding of teeth, Herring is given only 2. So this is also very important for podophyllum. The other very important thing about podophyllum is changeability. Their mind is constantly changing. Their thoughts are constantly changing. A very interesting rubric Mayer has given. Weary of life from bilious disorders. So they've become very depressed. And that you can read from Allen's. We never read this line from Allen's. Depression of spirits. Imagine he's going to die or be very ill. Disgust for life. We always think, oh, Disgust of life, aurum metallicum. No, there is many more. Thirst for large quantity of cold water, like bryonia, yes. And violent cramps in feet, like viratrum, with painless stool, but viratrum has profuse stools. Intense desire to press the gums together, like phytolapa. So this is all a little bit very important area of Podophyllum. You want to keep in mind. Let's see what Massimo Maggiore says. Yes, they are one of the most hypochondriacal patients in the world, and they can be very, very suspicious towards the doctor. Oh, what medicine you're giving? Because I have liver problem. I have taken many medicines, doctor. I have to see, and he keeps on stroking the liver. So, can come close to a very hypochondriac nux vomica, hypochondriac arsenic, but with liver gastric related problem. Very interesting picture that I wanted to just share with you here. And I hope that someone somewhere can probably be helped. Aversion to smell of food is very important for Podophyllum. If a lot of aggravations, you can see milk aggravates, fruit aggravates, shellfish aggravates. This is a little bit about Podophyllum. So I hope that this was useful, and I hope that you can apply a lot of these ideas. And if you want to study with us, we have this very beautiful course where 150 hours of clinical training with all the best homeopaths across the world, teaching, training, only weekend certificate course. What else can I say? Join us.